6 signs of a weak heart that's not working well. It's easy to overlook the early warning signs of heart failure because they're usually quite subtle, but doing so can be extremely risky. Unfortunately, your body begins to slow down in its later decades, specifically between the ages of 60 and 70. It's possible that climbing a flight of stairs that you used to do by taking 2 steps at a time will now feel like climbing Mount Everest. Anyone who has ever watched a medical drama on television is likely aware of the classic warning signs that indicate an impending heart attack. The patient, typically an older man, will begin wheezing and gasping for air as the condition worsens. He then clings to his chest, stumbles, and finally collapses. In reality, the signs of heart disease are much more varied and subtle than in clinical studies. Today, we'll reveal some surprising signs of a weak heart that you shouldn't ignore. So let's begin. Number 1 on the list is chest discomfort. It's the most typical indicator that something's wrong with your heart. You can experience pain, tightness, or pressure in your chest if you have a blocked artery or are experiencing a heart attack. Pain originates in the back and radiates to the neck, jaw, shoulders, and one or both arms. Gut-wrenching discomfort that does not subside after a few minutes, worsens with movement, or fluctuates in duration or severity. If you have any of these symptoms, your heart may be weak. That emotion is hard to put into words because everyone experiences it differently. Many people have described the feeling as an elephant sitting on their chests. Some have described it as a fiery sensation, while others have compared it to a pinch. In most cases, the feeling continues for more than a few minutes. It can occur while at rest or while engaging in physical activity. A heart attack is unlikely if the pain is temporary or located in a region that hurts more when touched or pushed on, as both scenarios are inconsistent with a heart attack. Yet, it's still recommended that you see a doctor about it. In addition, medical attention is warranted if the symptoms worsen or don't improve within a few minutes. Remember that some people with weak hearts or heart attacks don't experience any symptoms. Also, it happens more frequently to women than men. Then comes nausea, indigestion, heartburn, or stomach pain. These symptoms may occur in some people experiencing a heart attack. They might be so sickened that they throw up. A weak heart can cause you to lose your appetite, shift your need, or even make you sick. Despite their lack of food intake, some persons report feelings of fullness or nausea. It's also possible that they'll feel soreness or pain in their stomach. This symptom is more common in women than in males. These signs and symptoms are typically brought on by congestion in the area of the liver and intestines, which causes digestion to be slowed or stopped altogether. We recommend you see a doctor. If your appetite or digestion changes, these could be signs of worsening heart failure. Of course, several other factors besides your heart might cause an upset stomach. After all, it could be the result of anything in your diet. But you should also be aware that it's also possible for it to occur due to a weak heart. Hence, if you're experiencing these symptoms and are at risk for cardiac problems, you should make an appointment with a medical professional to find out what's going on, particularly if you're also experiencing any other symptoms we've described. Third on the list is exercise intolerance. Make an appointment with your doctor immediately if you feel tired or out of breath after doing routine activities, such as walking up a flight of stairs or unloading groceries from a car. These are the signs of a weak heart. If you're dealing with this issue, you'll likely want to skip workouts, but giving up should be your final resort. We recommend engaging in lighter exercises, taking oxygen supplements, and using bronchodilators to keep your heart from worsening. Altering your regular workout program rather than completely giving it up is the best course of action to take in this situation. We'll explain everything you need about oxygen supplements if you have any doubts. Oxygen therapy is a treatment that involves inhaling a pure oxygen gas. Among persons who are often out of breath and exhausted during physical activity, using an oxygen supplement during workouts can help them push through for longer. This treatment can be administered in a hospital setting or at home. It can be provided for a limited time or over an extended duration. And if you're wondering what bronchodilators are, in that case, they're a medication that opens up your airways by calming the muscle bands that constrict them. As a result, they minimize hyperinflation, ease bronchial constriction, and boost exercise capacity. You should consider the discussed recommendations seriously if you frequently suffer from this issue. Another sign of a weak heart is irregular heartbeats. It's natural for your heart to beat quickly when anxious or aroused. However, it's also typical for your heart to skip or add a beat occasionally. But if you become aware of an abnormal rhythm in your heart for more than a few seconds, or if it happens frequently, you should consult a medical professional. This could indicate heart disease. The heart can beat faster to compensate for its diminishing capacity to pump blood effectively throughout the body. As a result, individuals may experience palpitations, described as a fluttering feeling in the chest, or a heartbeat that feels erratic or out of rhythm. Many people describe this as feeling like their heart is hammering or racing. There are usually simple explanations such as excessive caffeine intake or a lack of sleep. On rare occasions though, it may be a sign of atrial fibrillation. This disease suggests a weak heart and requires medical attention. If you've recently been suspected of irregular heartbeats, your doctor may recommend modifying your lifestyle to improve your overall health. In addition, you should probably avoid anything that could further weaken your heart. Taking these measures could keep your condition from worsening. Finally, get it checked out by a doctor. Next is shortness of breath. Do you find it difficult to breathe? Experts on shortness of breath say that it's a significant indicator of a weak heart and that you should not ignore it if it occurs. It's common to feel like you're suffocating or struggling to catch your breath when experiencing shortness of breath. As a result, you may have trouble or discomfort breathing. Dyspnea is the medical word for shortness of breath. When the heart cannot pump enough oxygen-rich blood throughout the body reacts by forcing the individual to breathe more rapidly to bring in more oxygen. Many who suffer from chronic shortness of breath say the condition has far-reaching consequences. It can interfere with your normal functioning and cause stress. In addition to those negative emotions, it can also induce anger and fear. But there are several strategies you may employ to deal with breathlessness, reducing the likelihood that it'll weaken your heart more and improving your quality of life. For example, maintaining a regular exercise routine might make you feel less winded and more capable as you go about your daily routine. Just remember that shortness of breath is completely harmless if you take good care of your heart. Last, edema. Peripheral edema is characterized by an abnormal fluid accumulation in the lower extremities. After a long day, edema could look like sock marks on your legs and ankles, especially if you wore tight socks or hose. A slight swelling in the extremities is very typical. Your doctor may check for this indication by pushing a fingertip on your ankle or leg bone to determine whether a depression or a dent is left behind after doing so. This condition, pitting edema, may be a sign of heart weakness. Having edema may indicate that your heart is not functioning correctly. This condition causes fluid to flow from your blood vessels and into the surrounding tissues. Because of the influence of gravity, edema most often affects the lower extremities, particularly the legs and ankles. As a result, significant physical changes such as swelling feet might be unsettling. Although heart disease is the most common cause of edema, it can also be brought on by other, less severe illnesses. It can be treated whether the edema is due to a heart problem, new medicine, or a diet shift. But a healthcare expert must first diagnose the underlying problem to speed up treatment. Never ignore any signs of a heart problem. A weak heart muscle or cardiomyopathy can be brought on by various conditions. Even if there's no immediate threat, the symptoms you're experiencing could be an early indicator of a more severe issue that may arise in the future. It's essential to address these warning signs as soon as possible, especially for people older than 60, to reduce the risk of developing long-term complications. We understand that making or maintaining these lifestyle changes isn't always easy, but eating a diet that's good for your heart is absolutely necessary as you get older. Stay positive and don't give up. A heart-healthy lifestyle is well worth the cost of sacrifice. This brings us to the end of the video. We'll be back with another informative one shortly. You should subscribe to the channel to avoid missing any content. Goodbye.